Welcome to Introduction to Veterinary Technology, Laws and Ethics. This is Chapter 1 in your McCurnin's Veterinary Technician Guide to Veterinary Technicians book, 9th edition. In every chapter, you're going to see learning objectives, and each lesson you're going to see learning objectives. It tells you what this chapter, what this section is about in the chapter, what the chapter is about. All of these are going to have key terms that you're going to need to understand. It's going to talk about what the chapter is going to cover, and these are hints as to what you should be focused on and what you should study in order to be doing well on quizzes and tests. I'm not going to go through and read each one of these. These are items that you should be able to read in your chapter and read through with this lecture. If you're either watching this lecture, listening to this lecture, or have chosen to go through it on your own, you should be able to understand these chapters. So we're going to go through each of these objectives in the lecture itself, but I'm not going to spend a lot of time when we come across these objective slides. First of all, the history of veterinary technology. In the 1960s, there was a veterinarian, a young veterinarian. His name is Walter Collins, Doctor of Veterinary Medicine, DVM, and he understood we're not necessarily veterinarians were extremely helpful in caring for animals, and he wanted to see them be all well trained, well educated, and be provided with the necessary tools in order to practice this profession alongside him. So he created the animal health technician and created the first school to teach animal health technicians to become important paraprofessionals. In 1989, the name animal health technician was changed to veterinary technician to better describe that they work alongside veterinarians. And today we have hundreds of accredited programs available in the United States to train veterinary technicians. Now, there is a movement in the United States today to switch that designation of veterinary technician to veterinary nurse. It better describes the profession that you all are interested in being a part of. It would help to streamline and make more cohesive the education that is necessary to register as a veterinary nurse across states in the United States. Currently, veterinary technicians are not required to be registered in each and every state in the United States. States like New Hampshire, Florida, and Kentucky do not have laws that regulate who can practice as a veterinary technician. This can be helpful for students who have gone through the program, maybe have not been able to pass the VT&E, and can practice in a veterinary hospital as a veterinary technician in Kentucky or in Florida. However, it does not let veterinarians and hiring managers understand what their veterinary technicians or nurses are capable of. And so being able to make sure that every student, every technician has had the same education, has the same skills, that would go a long way in making sure that this profession is protected and that you are valued for what you know and what you can do. As a veterinary technician, you can practice in a private practice, a general practice like a small animal practice, working with dogs and cats. You can work in a mixed animal practice like a farm animal or working with both farm animals and companion animals. You can work in zoos, aquariums, wildlife rehabilitation centers, research or marketing of veterinary products. As a kennel owner or pet sitting business, being a veterinary technician can really increase people's trust in you. As an instructor in veterinary technology programs, you would have to get additional education, as in a bachelor's or master's degree, in order to do that. Specialty practices, where you're working specifically with, say, eyes or skin or surgery, or as you can, within that specialty practice, you can advance as a veterinary technician specialist as well. The National Association of Veterinary Technicians of America, NAVTA, has developed, this is the large group of veterinary technicians across the nation. They've developed the Committee of Veterinary Technician Specialties, or CVTS. This provides a standardized test of criteria and assistance for societies interested in attaining academy status. An academy is a group of people who have together developed special interests and special skills within certain specialties: equine practice, animal behavior, emergency and critical care, dental care, zoo animal, internal medicine, anesthesiology, and there are several more. So if you have a specific interest in one of these areas, it requires some additional training, a building of case studies, lots of experiences, but you can specialize in these areas and get better pay and better jobs because of it. Nicely, we have great employment prospects for this job. Salaries are increasing, but we do have an issue with attrition. So we'll talk about those things. Employment of veterinary technicians is projected to grow more than 20% from 2019 to 2029. So that's a huge job increase, where usually job growth is around 7%. Your level of experience, location where you work, if you work in Cincinnati versus Dayton, or New York City versus Dayton, your field of interest, they all have a significant impact on your income potential. You might, as a specialist, an anesthesiology specialist working in New York City with 20 years experience, you might make $72,000. But in Dayton, Ohio, starting out, your chances of making $72,000 are pretty slim. So making $30,000 would be a little bit more realistic. Before beginning a job search, veterinary technicians should itemize all expenses. That means budget. What do you pay for your car, your rent, your mortgage, your electricity, your streaming services, your Wi-Fi. What are those things that you spend money on right now? You need to understand what you need to make in order to maintain your lifestyle or even expand it. Veterinary technology also has a high rate of attrition. Attrition means that people leave the practice, leave the profession. Now, normally at this point, we'd have a discussion as to why you think that is. I will tell you that if you look at your class list, or if we're actually able to sit in a class and you can look around you, you will see that most of your classmates are young females. That is the significant. It is a significant statistic in veterinary technology that most of our students, most of our graduates, most of our employees are female, and we all start young. So what we see is life changes. So people stop to get married, stop to have babies, have a family, and don't necessarily continue on in the job. A second reason is that you may not have realized how passionate people are about their pets, and how emotional they can get, and how difficult it can sometimes be to deal with people who are passionate and emotional about their pets. And that is something you definitely have to think about at this point. How do you want to move forward, and are you emotionally strong enough to move forward in this profession? Education for a veterinary technician. There are 2-, 3-, and 4-year programs. They must be accredited by the CVTEA, which is the Committee on Veterinary Technician Education and Activities. And this is a group that sits under the American Veterinary Medical Association. Our program is fully accredited by the CVTEA. We do have to go through inspections every 5 years to make sure that we're on track and our graduates are doing well. There is a standard criteria required for each task. So every skill that you are required to perform has standard criteria, and you must be evaluated on that criteria. There are over 250 skills that we are required to evaluate you on. There are programs that provide distance education. This is online education. Typically, these programs, in the past, my research has shown that they do have lower retention rates and lower passage rates. However, it is sometimes the best way for some people who are working full time to get their education. Within Ohio, once you have graduated from a 2-year program and are registered with the state as a veterinary technician, you do need to continue your education. Every 2 years, you need to get 10 continuing education units. That's 10 hours of continuing education every 2 years, which is absolutely doable. Most of the time, it is provided for you free of cost. Sometimes you do have to pay for it, but keeping up with medication changes in medical practice, best practices is vitally important to maintain your license. The Veterinary Technician National Examination, this is the VTNE. This is the high stakes examination that every graduate must pass in order to become registered as a veterinary technician in the state of Ohio. It's offered 3 times a year in 30-day windows. You must get 150 multiple choice, or you must get 75% correct out of 150 multiple choice questions. Now, there usually are more than 150 multiple choice questions on the test because they have several trial questions as well. Candidates must be within 6 months of graduated from a AVMA or CVMA accredited veterinary technician program, or have graduated already. In Ohio, right now, they're still mandating that you must graduate first. Examination covers the 9 primary domains of veterinary technology, which I will cover in a bit, and your preparation for this high-stakes exam starts today. Information that I share with you over the next 2 years, all of it is something that you could come across on the VTNE. Not only the information that I share, but the way of learning information, the way of critically thinking through test questions, all of that is important for you. So it starts today. That means you need to start paying attention today and every day after this. The 9 domains of the Veterinary Technology National Exam are pharmacy and pharmacology, surgical nursing, dentistry, laboratory procedures, animal care and nursing, diagnostic imaging, anesthesia, emergency medicine and critical care, pain management, and analgesia. Now, we will teach you each of these things. We will teach you how to learn in each of these things as well. Because we have a 5-semester program, 3 semester which is primarily focused on the second-year student preparing for the VTNE, much of the information that we give you, it covers a majority of what you're going to find on the VTNE. However, we cannot cover everything. And so we just encourage you to continue to stay curious and to continue your learning as you're going through this program, and as you graduate beyond this program, to learn all those little bits and pieces that we can't fit into our program. Some features of the profession of veterinary technology. This profession comprises, any profession. Why do we call it a profession? It comprises individuals who have completed specific undergraduate or graduate education programs within the framework of a liberal arts institution and have successfully passed national or state qualifying examinations. The profession is based on a specific body of knowledge that leads to defined skills, abilities, and conduct. The profession provides a specific service. The profession comprises individuals who act independently and make decisions based on observation, knowledge, critical thinking, and independent analysis. And let me state this very clearly. This is a profession that requires you to think. If you want a job that tells you what to do, this is not the profession for you. We need you to think for yourself, but using the knowledge that you have and that you are being given. This profession has a code of ethics and conduct. The profession is structured by practice acts and corresponding rules and regulations in each state or province. And these laws and regulations are enforced and upheld by an overseeing committee, which is typically the state licensing board or the state board of governors. We'll cover that in a minute. Within the veterinary technician practice model, this is the professional way of going about your business every single day. So this is the list of what to do, but during this list of what to do, you have to use your brain. First, you gather data about the patient. You need to know what is the right data to gather about the patient. You need to know about the patient. You're going to identify and prioritize patient evaluations. You need to know what the priorities are. You're going to need to develop and implement a plan for patient care by establishing a series of technician interventions, evaluate that patient's response to the plan of care, and then gather additional data. So you're going to go back to step one and reevaluate the patient. When you use this model, gathering pertinent data, prioritizing, developing evaluations, doing technician interventions, doing what you know you can do legally, and then reevaluating, you become an important part of the veterinary hospital, not to mention the critical care of each patient. When you are going through this model, it's important to keep in mind your scope of practice. What are you allowed to do versus what are you not allowed to do? I want you to know that only veterinarians may prescribe, diagnose, prognose, perform surgery, or attest to health status, meaning you can't sign certificates or anything like that unless or until you're a veterinarian. What does that mean practically for you? And a lot of people don't think this through because it's very easy for us to be helpful. Well, what that means is you have a friend who finds out you're in a veterinary technology program. First of all, in the first year of this program, I would highly recommend that you just tell your friends that you're not in the program yet, that you're taking prerequisites. That will keep you out of trouble because you're not at a point yet where you can start to say anything in an educated manner. When it says, my dog stepped on a nail, what do I do? You cannot say, put some Neosporin on it. That is prescribing medication. You cannot diagnose it. Oh, it's a puncture wound. Of course you know it's a puncture wound. You can't diagnose that it's a puncture wound. You cannot diagnose that it's an infected puncture wound because he stepped on a nail. That's not in your scope of practice. You cannot say, oh, he's probably going to be okay. Oh, he's probably going to get an abscess, or he's going to get a bone infection. You can't say that. Prognosing is making a statement as to how the animal is going to proceed with the disease or get better. You cannot perform surgery. You can't say, well, let me take that nail out and stitch it up for you. That is not within your scope of practice. So what you can say is, oh, that sounds awful. You should take your pet to the vet and have them take care of it because it could get infected. It could be a major issue. It needs to get cleaned out. It needs to have antibiotics. I can't do any of those things because I am a student. Okay, so it's really important that you stay within your scope of practice. Some responsibilities you might have within a practice. You could be working in the reception area, checking in and out patients. You might be working in an exam room and without patients. That means, say a pet comes in for vaccinations. They come in with their client, their owner. You go through the physical exam. You let the doctor know what's going on. The doctor does a physical exam. You prepare the vaccines. You give the vaccines, and you send them on their way. You might work in a laboratory or in a pharmacy as a veterinary technician. You might work in the radiology or special imaging area. We do x-rays, we do ultrasounds, we do MRIs, we do endoscopy. You might work in the back area, the treatment room or the operating room, as an anesthesia tech or a surgery tech, or within the treatment room doing dental procedures. In a larger hospital, you might do nursing care within wards, equine wards or small animal wards, or you might be in charge of hospital management and communications. Moving on to the next portion of the roles of professionalism in the veterinary technician, we're going to be talking a little bit about different organizations, the veterinary healthcare team, being professional in appearance and conduct and communication. The veterinary healthcare team This is not a hierarchy per se, except in terms of the education needed in order to practice within this profession at these levels. The veterinarian receives the most education. Veterinary technician specialist, then the veterinary technologist, then the veterinary technician, then finally the veterinary assistant. Laboratory animal technicians, technologists work within a laboratory animal setting, and they get a completely different set of education and training. All jobs are essential to the care of animals in the medical setting. There could be additional jobs in the hospital that are not related to the veterinary healthcare team or the medical team. These include receptionist, office manager, personnel manager, and marketing team. The veterinarian receives a Doctor of Veterinary Medicine, or DVM. There are some programs that offer a veterinary medical doctorate, or a VMD, but they are all pretty much the same thing. That's a 4-year 4 years of study at an AVMA accredited school of veterinary medicine after completing anywhere from 2 to 4 years of undergraduate study. You have to have prerequisites in order to get into a 4-year program, and it typically takes about 2 to 4 years to complete those prerequisites. The veterinarian must be licensed by the state or province in which he or she works. That means we have 6 to 8 hours of higher education above high school. A veterinary technician specialist, or VTS, is a veterinary technician, RVT, who has reached a higher level of skill and understanding in a particular field of veterinary technology. And they often work in specialty and referral veterinary hospitals and in teaching hospitals associated with universities. When you are watching or looking at this lecture on your own without the recording, I highly recommend that you watch this video. Kind of gives you an understanding of the different roles that veterinary technicians can have. Veterinary technologist receives a bachelor's of science. This is a 4-year program. They work in positions that may require a greater level of education than is required for veterinary technicians, such as a project leader, practice supervisor, teacher in a veterinary technology program. If you want to work in the industry, in a pharmaceutical industry or a research industry, it is required that you do at least have a Bachelor of Science. It could be a Bachelor of Science as a veterinary technologist or a Bachelor of Science in biology with your RVT. A veterinary technician, or RVT, in Ohio is required to complete national and state examinations before he or she can be licensed, registered, or certified, and in Ohio it's registration. Often you're required to pay a fee to the State Veterinary Association to receive a license, and that is true. It's, I believe, $75 in the state of Ohio. So what that means is that our RVT in Ohio must pass program requirements, graduate, pass the VTNE, and then apply for RVT licensure within the state. A veterinary assistant is somebody that is involved in the care of animals, but is not a veterinary technician, laboratory animal technician, or a veterinarian. There's no education required for this position, just on-the-job training. You can go from high school and work directly in a veterinary hospital, and you get paid to be trained to be a veterinary assistant. I do often say that it is not necessary to go to a specific veterinary assistant school or program and pay to get trained as a veterinary assistant. Most veterinary hospitals will take you and train you without requiring you to pay to become trained. In doing some research and talking with veterinary hospitals, they will not necessarily pay more for somebody who has already been trained as a veterinary assistant. You may get a second interview trained as a veterinary assistant, but it doesn't necessarily guarantee that you'll get a job or higher pay. So I do warn you about that. The second thing that I will say about that is that it is much more important that you show a willingness to work, an ability to learn, and a good attitude. And those are things that can carry you along. Animal technicians and technologists are a whole nother subsection. There's an American Association for Laboratory Animal Science, and they've established a certification program that certifies levels of animal technicians working with a laboratory. These are the Assistant Laboratory Animal Technician, the Laboratory Animal Technician, and the Laboratory Animal Technologist. Moving on to professionalism. Veterinary technology is best represented by the excellent skill, ethical conduct, and passion of its members. Veterinary technicians are established by NAVTA. So normally at this point we would have some discussion about what professionalism means, and we'll go into that throughout this lecture. But I will say that we do expect professionalism of our students, of our graduates, and of all veterinary technicians within the area. We do push this, we do require it, we do look for it, we do evaluate, and we will tell you if we don't feel like you are acting with professionalism. Professionalism starts with appearance. First impression business. You are making first impressions on clients every single day. So making a first impression on the place that you work is really important as well. So paying attention to your uniform, making sure it's clean, pressed, free of hair, making sure your hands and nails are clean. Keeping your nails trimmed is really important. We work with a lot of pretty dirty substances, and anything that is caught underneath your nails could be ingested into your body at some point. So parasites, bacteria, funguses, that kind of thing. Also, jewelry, your face, your hair, all of these things need to be kept distraction free so that people can concentrate on what you're saying, not what you look like. Your attitude has a lot, and your body posture has a lot to do with your professional appearance as well. The picture of the man sitting with his feet up on the desk does not appear to be professional. So here's some examples of good professional appearance. Somebody working with a laboratory, making sure that not transferring possible diseases from animal to animal. Somebody with a nice polo shirt, and I can't tell if those are scrub pants or cargo pants or something, but they're nice and clean, or whole scrub outfit. Professional conduct. We look at professional conduct both inside and outside of the workplace. You might say, oh, you can't control me outside of work, but unfortunately your behavior outside of the workplace can be tracked. Social media is a big thing. You don't always know where those videos are and who is posting them. And it does make a difference. And because you are in a profession that requires a certain code of ethics, any of those things can be looked at in order to make sure that that you are practicing within this profession appropriately. Communication is extremely important. Verbal communication is important, but also written communication is even more important. Medical records, email, text messaging, these are all things that could be subpoenaed by a court, and when they become legal records, they become public. And so anything that could become public record, it will reflect on you. So there are some things that you should verbally, if you're in verbal communication, should avoid, like, kind of, sort of, any curse words, unprofessional slang, this and stuff, and I guess, anything that seems a little bit wishy-washy, and it doesn't seem professional. Written communication should be written out, not in text language. Shouldn't have smiley faces all over the place, shouldn't have exclamation points all over the place, should make sense, should be cohesive, should be concise. These are things that you should be paying attention to right now in order to make sure that you are communicating appropriately. Becoming a part of a professional organization can keep you up to date on what's happening at national, state, provincial, local levels. There are a lot of organizations that are available to join. They also support education, so you can get scholarships. They support professional interests, activities of the veterinary technician. There are several levels. National level is the National Association of Veterinary Technicians of America. That's NAVTA. We do have a student chapter that we will ask you to join in your second year. There's a Registered Veterinary Technologists and Technicians of Canada, which if you're close to Canada, that might be an option. Or the Ohio Veterinary, it's actually Association of Technicians, which is OVAT, that is available for you. And the Miami Valley Veterinary Medical Association, or MVVMA, is available as a source of support for veterinary technicians, but it is primarily a veterinarian association. Ethics, professional ethics. Ethical questions are often really complicated in veterinary medicine because veterinarians and technicians serve not only the patient but also the client. And sometimes we have to consider the question of the right conduct, asking for whom is it right? So is it right for the patient, or is it right for the client, or is it right for both? Profession-related laws and regulations. So as with any profession, there are laws and regulations, and they're mostly state-based. Each state has a practice act that is considered the primary law that governs the practice of veterinary medicine and veterinary technology. The practice act is the primary law for the profession. The practice act governs veterinary medicine and veterinary technology. Practice Act must be enacted by the legislature, and the leading professional organizations have proposed model practice acts for states and provinces to use. So the AVMA, which is the leading professional organization in the United States, proposed a model practice act. The state has adopted that practice act and modified it slightly to lie within its own laws and regulations. So we have laws, and then we have rules and regulations that are written by each state's Board of Veterinary Medicine, called the Board. In this state, it's called the Ohio Veterinary Medical Licensing Board, or OVMLB, and I have a screenshot of the website for you. And then I also have a screenshot of the Ohio laws and rules, and you go on and look into the Ohio Revised Code or the Ohio Administrative Code for any laws within the state of Ohio. The review process of regulations varies from state to state, but in general, regulations, which are what the OVMLB puts forth, do not have to be approved by legislature or the governor. So it's a lot easier and less costly to change and update the Practice Act than it is to change laws. So what are laws versus regulations? So laws are enacted, regulations are promulgated. Violation of the State Practice Act or the law means monetary penalties or imprisonment or both, okay? So if you break the law, you may go to prison. Violation of a regulation could mean monetary penalty, possible sanctions against the violator's license, but no imprisonment. So if you violate a regulation of the OVMLB, they can say slap on the hand, they can give you a monetary penalty, but they cannot imprison you. So that's the difference between the law, which is enacted, and the regulation, which is promulgated. Okay. So, for instance, on the OVMLB, now this is, I don't believe we can pull this particular page up anymore, the disciplinary actions that just randomly list them. But I do believe you can go to various people's specific licenses and look up and see if they've ever had a violation or a disciplinary action against them. So this is a previous website that I've pulled up, and it tells you exactly what section of the Ohio Revised Code that they violated, and section 4741.22 A1 and 25, and you can read that section. In general, what may have happened, you may have to make some guesses, and then you can look at what the penalty was. So sometimes it's they mislabeled a drug, or they did not give a medication correctly, or they performed a surgery when a surgery was not necessary, or they didn't do a surgery really well. So that's where there may be some issues, and you can see what has happened. So some people get suspended, some people have a fine, some people just need more CE. When you want to get into practice, it will depend on your location. And your credential may be referred to as either a licensed veterinary technician, certified veterinary technician, or registered veterinary technician. In Ohio, it's registered veterinary technician, but that's why you may see somebody as an LVT, a CVT, or an RVT. Requirements for licensure are good moral character, so you have to have a background check, and you could be refused licensure based on a poor background check. You do need to renew your license every 2 years, and you do have to have continuing education every 2 years, a certain amount. So if you can remember how many continuing education credits you need in Ohio every 2 years, the number is 10. There is within this website a section called Criminal Background Information. And if you click on that, that will take you to something that will tell you what crimes might keep you from becoming licensed. It's really important that you do this if you have any questions, because we do not want you going through a program for which you cannot get licensed. So, grounds for disciplinary action in this profession. Technical violations are when there is no direct link between misconduct and harm to an animal. You're subject to prosecution and discipline, and this could include a lapsed license. Oh, I forgot to re-register or renew my license. That doesn't work. You will get fined for that. Failure to complete required continuing education, criminal conviction unrelated to the profession, discipline by another state's licensing board. Substantive violations bear directly on conduct while practicing the profession, and these include fraud and deceit, crimes of moral turpitude. Crimes of moral turpitude include kidnapping, murder, rape, crimes of aggression, misrepresentation, animal abuse. Any animal abuse or animal neglect will keep you from maintaining your license. Committing or aiding illegal professional acts, and working impaired. There are 3 levels of supervision, and I'm going to skip to the disciplinary actions. I'm going to go back to the levels of supervision in a minute, but if you were to be disciplined or found that you have not done something that you were supposed to do, or have done something you weren't supposed to do, you're going to get a notice which will give you a right, tell you that you have a right to a hearing. You can use a lawyer or not, and what those hearing proceedings will be. And you will go before the board and state your case. Your disciplinary sanctions that can be leveled on you from the board would be a license revocation or suspension, probation of the licensee, reprimand, or civil penalty, which is a fine paid to the licensing board. Some of the grounds for disciplinary action would be, and we're going to go back to levels of supervision here, but these are really important to keep in mind, because if you practice outside of these levels of supervision, or you're not doing what you're supposed to be doing, this is what can lead to disciplinary action. So these 3 levels of supervision of veterinary technicians means immediate supervision. That means a licensed veterinarian is within direct eyesight and hearing range. They're standing in the room with you. Direct supervision means a licensed veterinarian on the premises and readily available. They may be in the next room, but you can call to them. Indirect supervision is the licensed veterinarian is not on the premises, but maintaining direct communication, meaning you can call them and get direction. If you practice beyond this scope, you're doing something that you're not supposed to be doing without a veterinarian there, then the licensee may be prosecuted and disciplined for practicing beyond the scope of practice authorized in the state, and is considered most serious examples of misconduct committed by a licensee. It demonstrates a fundamental misunderstanding of the role of the licensee or deliberate disregard for the role of the licensee. You need to understand the scope of practice and what is prohibited in Ohio. I have prepared for you from the OVMLB, that comes from the OVMLB. There is a sheet that tells you what a veterinary technician and a veterinary assistant are permitted to do and what they are not permitted to do. And that information is in your course shell, and it's also on the OVMLB website. It is important that you understand what's in there. Some other grounds for disciplinary action beyond practicing beyond the scope of action practice would be unprofessional conduct. That's why we talk about it. Malpractice or negligence, incompetence, so not knowing something. Knowing something and doing it incorrectly anyway is bad. That's malpractice. Not knowing something when you are supposed to know something is incompetence. If you have been through a program, you should know it. Sleeping that day does not count. Veterinarian may be also disciplined for the technician's conduct. This is why you will see more DVMs disciplined than RVTs, and that is why they will insist on well-trained workers who can follow instruction. And that is why they may get grumpy with you if you are not paying attention or not following instructions. So we went through the process of disciplinary action. Some additional laws governing veterinary practice. There are labor law issues, so if a hostile work environment, sexual harassment, that kind of thing, is a part of what we need to consider when we're working in a veterinary practice. Also, safety in the workplace. There are a lot of hazards within our workplace that we need to consider, and there are medical waste management, so laws about controlled substances. There are additional laws, animal-related laws, anti-cruelty laws. If there are animals used in research and education, which we use in our program, Animal Welfare Act, we have to follow that. The Horse Protection Act, including soring, which is a practice of causing damage to a horse's legs in order to increase inflammation and blood flow to the area, it's painful, and it is now outlawed, but it is something that we have to pay attention to, especially working with equine. Endangered Species Act, and then wildlife rehabilitation. If you have any questions about this lecture or anything that it brought up, I would really like to hear from you when we get together. Thanks for listening.